10 mental illness signs you should not ignore. Number 1. Uncontrollable or heightened levels of worry and anxiety. You may have anxiety if you find yourself constantly worrying without being able to shut it off. Insomnia, unexplained aches and pains, racing thoughts, or trouble relaxing could also be signs of an anxiety disorder. According to the Anxiety and Depression Association of America, if you have felt this way for at least 6 consecutive months, it may be time to consider seeing a mental health professional. 2. You've noticed delusions or hallucinations. There are 2 aspects of psychosis, namely delusions and hallucinations. A sense of perception or belief that creates an urgency in the person experiencing it. Despite evidence, the perception or belief isn't real. According to NAMI, every year at least 100,000 people experience psychosis every year. They've added that at least 3 out of 100 people will have a psychotic episode as a result of a mental or physical illness, such as schizophrenia or schizoaffective disorders. Number 3. Alcohol and drug abuse. As a result of mental health research, at least 1 out of 4, or about 25% of people who live with a mental illness will use alcohol or drugs to self-medicate things such as anger, anxiety, or mania. Those who suffer from personality disorders, anxiety, or schizophrenia are more likely to use alcohol and drugs as a coping mechanism in comparison to those who are diagnosed with other mental illnesses. Number 4. Extreme mood swings without explanation. Are you emotionally volatile? Do you often find yourself moody or caught between emotions without knowing why? Studies show that people will experience happiness, joy, or positive emotions more often than negative emotions. But it's completely normal for people's emotions to shift daily. However, the National Alliance Mental Illness, or NAMI, says that major shifts or dramatic changes in one's mood swings on a daily basis could be a result of bipolar. Number 5. Isolating yourself or withdrawing from others. Sometimes taking some time off from your friends or loved ones can be great for your mental and physical health, but constantly making up excuses to avoid socializing could be concerning. Studies show that the lack of participation in activities or events that you used to enjoy could be a sign of a mental health issue, such as anxiety, depression, or psychotic disorder. Number 6. Feeling sad or depressed for more than 2 weeks. Many of us feel sad at times. In most cases, it's temporary sadness and it usually goes away after a few days. However, if you're feeling sad for longer than 2 consecutive weeks, it could be a sign of depression. If you feel as if you're stuck in a deep, dark emotional state, or if you feel as if your emotions are heavier than usual, this should be taken seriously. Number 7. You're struggling to deal with normal life situations more and more each day. You know those days where everything just doesn't seem to be going right? Like on the morning before an important meeting. You're not only running late, but also realize that your gas tank is empty and you just can't deal. Well, the Australian Department of Health says that when you're experiencing a tough time and cannot seem to get past it, when this affects your ability to perform your day-to-day functions for at least 2 consecutive months, it could be a result of depression or anxiety. Number 8. You've started thinking about self-harm or suicide. The Mental Health Foundation reported that up to 10% of people under the age of 30 have thought about committing suicide or harming themselves. There are so many reasons why people would consider harming themselves, such as abuse or neglect at home, a major loss, trauma, or a catastrophe that cannot be controlled. Studies show that at least 90% of people who have committed suicide had suffered from a mental illness, especially a bipolar disorder or depression. If you ever think about committing suicide or self-harm, we highly recommend that you speak to a mental health professional and get the help you need and deserve. Number 9, changes in your sleep. You're sleeping way too much or way too little. The Harvard University School of Medicine believes that 10 to 18% of the general population has problems sleeping. However, people who sleep too much or too little are more likely to suffer from a mental disorder. About 50% of people who suffer from insomnia or hypersomnia are likely to have either bipolar disorder, depression, anxiety, or ADHD. Number 10. Extreme anger outbursts. Uncontrollable anger, or if you feel as if your frustration is way too much for the situation, this could be your anger trying to warn you about your stress levels, unresolved issues, or anxiety. Healthline reported that extreme anger outbursts could also be a result of trauma, alcohol abuse, bipolar disorder, OCD, or depression. If you're trying to figure out whether your anger is healthy or not, try to identify the physical or emotional signs of anger first. If any of the mentioned symptoms sound familiar to you, remember that you're not alone. We care about your well-being, so consider reaching out to a mental health specialist if you're feeling emotionally overwhelmed. As always, thanks for watching Psychedologists, and remember, if you liked this video, then be sure to subscribe for more.